Well, just really the infections, as far as I can see, are spread by people.
I don't believe that you should stop children from being in contact with every infection. However, you don't like to put them at too much risk.
Very little, I'm afraid, because I don't go to hospitals very often. Only today I've had an accident and I'm here with my hand.
We always thought initially that these bugs were just to do with hospitals and that these bugs just originated in hospitals. Of course, transmission of these bugs is very important because although somebody who's quite fit might transmit it, when a frail person gets these infections, they then become incredibly ill and, of course, can even die.
Every day you open the newspaper or you look at the TV and there's something about infection, particularly within hospitals. Infection can be anywhere, in your own home, in a hospital, in a GP practice. There are many things that you can do to take responsibility in the fight for infection. One of the most important things to do is make sure you wash your hands.
The crews, through their basic training, are taught standard universal precautions. But within that, there's hand hygiene. And because our crews work in a multitude of environments, they understand the importance infection control plays in reducing healthcare associated infections. We have cleaning equipment on the vehicles, and the crews pay particular attention to the equipment that the patient uses and also their hand hygiene. This will help protect our most vulnerable patients.
Infection control, in its essence, is about stopping the spread of infection from one person to another. That could be from a member of the nursing team to a patient, or that could be from a patient to a member of the nursing team. It also involves spread of infection from visitor to patients and from anyone who may be visiting in the ward area.
The cleaners have a routine schedule which they clean each ward area on a daily basis. In between patients leaving, we steam clean the whole area that patient is in. That includes the bed, the locker and any chairs that they've actually used. This is to reduce the risk of infection for when a new patient comes in.
The difference relating to infection control is having to adapt to a home environment, which is quite different possibly to working in a clinical hospital environment, and we have to adapt our procedures accordingly. But it is just as important in the community to be looking at infection control and all the issues related to that, and this relates to the whole spectrum of health professionals working in the community, such as physiotherapists and occupational therapists. Hand washing is obviously extremely important, but the use of gel, which we have with us, we all have these, which we actually use in conjunction with hand washing. It is effective against organisms such as MRSA, which is as prevalent in the community as it is in the hospital setting. Unfortunately, Clostridium difficile isn't effective. This isn't effective for that, so this is why hand washing is totally necessary. Liquid soap is obviously better than bars of soap. Bars of soap do harbour infection, so we do ask the patient to provide liquid soap. If that's not available, there usually is washing up liquid which we can use, and paper towels are obviously better than the patient's own towels there from an infection control point of view.
As medical director of this PCT, one of the things that's really important is the standards of care that's offered to patients, to make sure that actually patient safety is at the heart of everything that we do.
What we've been doing, infection control, we've been trying to control it in our department. But what we've realized that we've put the gels on the walls. So what we've asked people to do is to actually ask them to physically say, this is the gel, can you use it when you come in and use it when you go out? People have cordoned on and they've been doing it ever since, and it's now a normal practice. For those patients who come in and they can't use gel, mainly because they obviously religious backgrounds or people who are allergic to the gel, we always find alternative for them to use soap and water, which is quite effective. And we try to encourage everybody to at least use one or the other.
Well, of course, these infections, whilst they can be minimised in terms of the transmission by hand washing, and that can only be the common message that hand washing and use of gels is really important, the use of antibiotics, and certain types of antibiotics in particular, can actually be the reason why these infections get going in the first place. So it's really important, and I know that health professionals are really looking at making sure that they actually use the right antibiotics at the right time, and that actually antibiotics are not always the answer to all ills. So I think that it's really important that we try and make sure that we all take the responsibility of hand washing in particular, and gels whenever that's appropriate, to make sure that both from a health professional's point of view, me being a local doctor, but also from a public's point of view, as one who doesn't want to see this infection transmitted to anyone else in a vulnerable situation, I think it's up to everybody to try and change their culture. Make sure you wash your hands whenever that's appropriate and whenever that can reduce the risk of infection being given to others.